Hello, Lisa Broyles with Way to Health MD, and this video is to discuss the new weight loss drug, Wegovy. Wegovy is the brand name for semiglutide, which is also known as Ozempic. Ozempic is the same drug as Wegovy, it's just Ozempic is marketed for type 2 diabetes, whereas Wegovy is marketed for clinical obesity, aka weight loss. So you may have seen some hype in the news about people taking Ozempic. I think Ozempic's easier to say, so they call it that versus Wegovy. Anyway, people taking it and losing massive amounts of weight. So I'm getting a lot of questions about it. So here's my take on Wegovy/Ozempic, which is semaglutide. I think that this drug clearly does work to help people lose weight, and markedly people can lose up to like 60 pounds. So large weight loss with this drug. The way it works is that it does tell the brain that you're not hungry. So you're not hungry, so you eat less, plain and simple. It does lower blood sugar, so if you are not a diabetic, you have to be careful about hypoglycemia. If you are a diabetic, great news, this drug does work for you. Bad news is you have to stay on this drug to maintain the effect. So we are seeing people that once they stop the Ozempic, they do gain the weight right back. In the year following being off of it, we have seen people gain at least the 60 pounds back that they lost, and sometimes more. So please be aware, if you do decide that you want to be on Ozempic or Wegovy for weight loss, understand that this is a most likely lifelong commitment unless you can substantially increase your lifestyle, like exercise, the way you eat. But honestly, people have had a really hard time even with exercising and really watching what they're eating. Once they go off the Wegovy, they gain the weight right back. So that's one concern that I have. The next is the price tag. If you're paying out of pocket, the Wegovy runs about $1,400 a month. It is difficult to get your insurance to cover this drug, even if you are a diabetic. The next concern I have is some of the side effects. Common side effects are nausea, vomiting, diarrhea, constipation, abdominal pain, fatigue, dizziness. However, there is what's called a black box warning on Ozempic, which means a potentially deadly complication from being on this medication, and that's a rare form of thyroid cancer called a medullary thyroid cancer. So if you have known thyroid cancer, then this drug can make that cancer grow. Or if you have a condition that runs in your family called MEN, or multiple endocrine neoplasias, people that get multiple different types of endocrine tumors, with this syndrome, they're going to be at increased risk as well. So that's kind of scary. It's rare, but it can cause a rare form of thyroid cancer. So I do think that this is not a drug to be taken lightly. There are other weight loss drugs that have been around for longer, like phentermine. I've used phentermine for years to help patients lose weight. They tend to lose about 20 pounds. And again, after being off of it, they tend to gain the weight right back. So that's the problem with weight loss drugs. They work while you take them, and then when you go off them, people typically gain the weight back. So my preference is to work with you with lifestyle, diet, nutrition to see if we can optimize your weight naturally. Thank you.